And now, in celebration of World Mental Health Day, experts have encouraged young people to normalize calling for help and seek professional consultation and treatment, especially among the youth. With the theme, Mental Health is a universal human right, experts are calling for increased funding for the sector and increased awareness as well that is more directed at improving access to wellness. News Central's Adeshewa Odushoga reports.
It is one day set aside to draw the attention of the globe on mental health and its challenges. For the 2023 World Mental Health Day, with the theme, Mental Health is a Universal Challenge, a consultant psychiatrist and the head of Department Psychiatry, Federal Medical Center Umuahia, Dr. Chizoba Acho, identified that stigma and discrimination remain the major challenges of people with mental health challenge.
And the aim is to reduce discrimination, reduce stigma, and make mental health a point of reference for everybody to care for his or her own mental health. If there's proper awareness and more education and visibility, I'm sure that people would understand what it means to care for their mental health.
The myth that mental health issues are lifestyle-induced or repercussions of wrongdoings are some of the beliefs that the awareness campaign should address, according to Dr. Abimbola Uthman.
They don't even know what mental illness is. They believe that it's only those who are on the street that have a mental illness. Whereas mental health itself is about ability to cope with adversity, not only mental illness. So even what we are doing today, mental illness includes positive mental health. It also includes mental illness or mental disorder. So everybody needs mental health to be able to function. In fact, there's no health without mental illness.
As for the director, Amudo Integrated Community Mental Health Foundation, Reverend Kenneth Mubani, there is need for awareness of mental health in order for one to manage his physical health.
The major issue is that anybody who comes down with a mental health problem is abandoned. So the underlying factor is discrimination. Everything we are discussing today, rests on discrimination. And WHO has said that non-discrimination is the key to, enjoyment of our fundamental human rights.
He said it is not an act of charity for one to assist another with mental illness get help, but a fundamental human right of that individual.
It has to be properly integrated within the primary. What do we mean? A system where if I have a mental health problem, I will not be asked to go to a different place. Whereas somebody who has a physical health problem will not be attended in another place. They need to work together, because somebody who has a physical health problem can develop a mental health problem at the same time. Why would you now refer that person to another place? It does not rule out the fact that the psychiatric professional institutions have to continue. But those places are tertiary institutions where difficult cases can be referred. However, anybody who has depression has no business going, to the tertiary institutions. Why would you not get service at the primary health care level?
It has been said severally that a lot of people have mental health challenges unattended to. But the good news is that with access to adequate treatment, mental issues can be treated successfully. Chinwe Ugele reporting for News Central.
Well, apologies for that. That was a report packaged by Chinwe Ugele and not Adeshewa Odushoga on mental health. Now, to further discuss this, I'm being joined on the news by a global mental health advocate, Kunle Pelemo. Thank you so much, Kunle, for joining us on the news.
Thank you for having me. Appreciate it.
It's a pleasure. Now, today the world marks World Mental Health Day. What does this day mean?
Thank you very much. The day was first celebrated, or the World Mental Health Day was first celebrated in 1992, and it was an initiative of World Federation of Mental Health, a global mental health organization with presence in over 150 countries. But the overall objective of the day, or the celebration, so to speak, is to create awareness about mental health and mobilize effort from people from all types of walks of life and see how they can create more support for mental health in different ways. That is the essence of the celebration.
Right. Speaking of mental health challenges, what are some of the challenges that people often overlook that could actually lead to mental health issues or mental health illness?
Okay. Speaking specifically now for, people in different clients, because I have created conversations as regards mental health in several clients. And the one common denominator there is the word stress. We have a whole lot of people who go through stressful conditions depending on the varying degrees that you are exposed to. But one thing that is so certain is in our lives, we cannot do without stress. Stress on its own is not bad, but your exposure to chronic stress is what is bad. And then how well you are able to cope with stress is what matters. So that is why it's so important. When we have people who don't really know how to cope with stress and they don't know what to do per time. So when you have all these things accumulate over a period of time, then they find themselves exhibiting some symptoms of mental health related issues such as anxiety, panic, and then so many other related issues like that. So stress is one key thing that is so much in abundance in our world today that we can't do without, and most people do not take cognizance of when we are talking about mental health.
Right. Now, in this age and time, a lot of people find it hard to come out and, tell the world that they're experiencing mental health challenges. But even those who do, are we well equipped enough, especially in this part of the world, to take care of their needs? Those who suffer mental health challenges, maybe they need therapy, they need treatment. Do we have what it takes to attend to these people?
Thank you. That's a very, very vital question. To just answer it straightforward, we don't have that capacity yet. And that's why conversations such as these are very important for government to see what they can do in that regard. And then for other people, other stakeholders in the sector to see how they can also come on board in improving the capacity that we can deliver when it comes to mental health. I know the sector had been plagued, by not having the mental health bill. What we used to have is the Lunacy Act of 1914 and amended in 1958 or so. But with the bill that was recently passed by the former President Muhammadu Buhari, in January 2023, that's this year, I think that is going to help in creating, number one, in harnessing, our resources towards mental health in one way or the other, making mental health like part of the basic healthcare of our system in general, and then also validating the rights of people who are having mental illnesses or having any mental health challenges. So these are some of the things that we need to do that we don't have currently, and we need to really up our game in that regard.
All right, mental health advocate Kunle Pelemo, thank you so much for joining us on the news to discuss Mental Health Day.